Hi everyone, welcome to OET 369. I hope you're all doing very well for your exams. So this is an episode 2 of writing a letter to different nurses. So in the last episode, we have seen writing letter to different nurses like community nurses. What are things you may include, all those stuff. So for those who haven't watched the video, please go back and watch it because that will be really useful for all of you. Because it is really important for you to know what is the content selection you may have to concentrate. So today we are back with the same, but we are going to discuss about specialist nurses. Okay, so in the OET writing profession for nursing, it is quite natural to ask, as a nurse, you may be required to refer a patient to specialist nurses. Okay. So we'll talk about this because this is a very detailed, or this is like very huge portion. I just had to create this as another video. So what are the specialist nurses that you may be usually asked in your OET exam to write a letter? So any specialist nurse it can be. For example, we are going to see a respiratory specialist nurse. Specialty number 1. So when you write a letter to a respiratory specialist nurse, you will have to think about their speciality. Okay, so imagine if the patient has a history of shortness of breath and was treated for that, you would probably have to say that to the respiratory specialist nurse. But if the patient had probably an appendicectomy, you wouldn't say that to a respiratory specialist nurse. You may have to closely see what is your expectation from that specialist nurse, or what is the main purpose of that letter to a specialist nurse. For example, just say like health education regarding inhaler use. So see, what are the important information that you may have to put here? You may have to talk about the patient's respiratory system history. You may not have to say like the patient has hypothyroidism or the patient has osteoarthritis. Those things are irrelevant. Just avoid all those. You may have to say the patient has asthma. You may have to detailedly say what are the factors that may probably cause this, non-compliance with inhaler or something, and that's why you're asking to health educate this patient. Okay, so that could be one scenario. The next scenario or the next specialty that you may be asked to write is to a diabetes specialist nurse. So diabetes specialist nurse, commonly you are, it is when you get a patient with diabetes, you ask for example, maybe a rehabilitation. Okay, so to control their diabetes or to manage the diabetes, that's one situation. You can also expect to be asked to health educate, to ask this nurse to health educate regarding diabetes. So diabetes specialist nurse is supposed to health educate. So if they request to be health educated, that you may need to say about that patient's lifestyle. Okay, you may need to say about the patient's disease condition. So if you want to say that, for example, the patient is non-compliant with diet, you may have to explain what is the patient's non-compliance really. You may have to say what does the patient do, so that they can health educate on those things. Okay, so that is one thing. And if it is diabetic management, I wouldn't say anything that has happened before it or any risk factors. I'll probably say what is the current level of diabetes or what is the current condition of the patient, and then you'll be asking to manage that particular patient. Okay. Now, the next scenario can be a cardiac specialty nurse. You can be asked to write to a cardiac specialty nurse in an acute setting where you have to expand or explain in detail about the patient's current cardiac status or the treatment that will be done. You may be also asked to write to a cardiac rehabilitation nurse. Here you have to rehabilitate the patient. So you will not elaborate the acute details. You will have to say about the lifestyle or the risk factors that may lead to cardiac diseases again. So it's rehabilitation basically. Okay, so think that. That is cardiac rehabilitation nurse. Or if it's a cardiac nurse in an acute setting, then you have to say about the patient's ECG, patient's current cardiac function status, all the things, or what are the tests, or what are the medications the patients take. All those things have to be explained. Now, the next situation could be a heart failure specialist nurse, sort of same. I think this is both very related to cardiac specialty nurse, so you will include the same type of information basically. Okay, and the next type of nurse, specialty nurse that you can expect is urology specialist nurse. So in this case, if the patient has problems with the urology system, so think about that and identify the history or problems related to that. Identify what is the urologist nurse supposed to do. Okay, so that's how you will formulate that case note. Okay, the next specialty I would like to talk about is nephrology or renal nurse. Okay, so in these type of situations, you probably ask the patients with renal dysfunction or acute kidney failure or chronic kidney failure patients. You just need to refer to them to assess their fluid balance or to promote their fluid balance or to teach them about fluid intake or to teach them about kidney functions and all. So basically, you will be talking about patients' relevant history associated with food and fluid intake, and you'll also say about the patient's history or patient's procedures that is that is very related to the renal system of the patient. Okay. Palliative care nurse specialist is another job role that you may be asked to write a letter to. Here, most of the students make mistakes because they think, oh, this patient is going to be very acute and, we have to include all these admission details, all the CT scan findings. No. If you're writing to a palliative care nurse, most of the times you're asking to palliate this patient or you're asking to provide hospice care or tender loving care for this patient. So you may be asked, you may have to give vaguely an idea. You have to clearly say that this patient may not be suitable for a particular treatment. Okay, you may have to say a little bit about the social history in this case because the palliative nurse would have to talk to family. So they need to know about that social history and the family situation. Okay, that's about palliative nurse. And the other situation is tissue viability nurse or skin specialist nurse. Usually you get this for elderly patients who are at risk of pressure damage. You think that this patient has a particular pressure damage and you may have to write to a tissue viability nurse. So you will have to say about the patient's height, weight, about the patient's mobility status, about the patient's skin condition. You may also have to mention about the patient's nutritional intake. That may be another factor that affects the skin damage. You also have to say the patient's level of cooperation, patient's pressure rate care or you think that this patient needs a particular pressure relieving equipment. So that needs to be asked to that tissue viability nurse. All those things are the situations that you may be asked to refer to them. Okay, so imagine this and plan your things in such a way. You can also be asked to write to a psychiatric nurse. Okay, so psychiatric nurse, you usually get it when you think the patient has any underlying psychological or psychiatric issue. Okay, so you may have to detailedly say about the situation of the patient which made you to think in such a way. You also have to detailedly say about the situations like family situation, any disease conditions that may cause delirium for this patient. So all these things have to be explained when you write to a psychiatric nurse. This is also applicable in the case of referring to dementia and delirium nurse specialist. So if the patient has dementia, you're asking the letter to, you're referring a letter to a dementia referral, or you're doing a dementia referral to a dementia nurse, you may have to say about the patient's cognition, level of confusion, what is the patient's current activity, and why do you actually make that referral. That's the first thing you would say in that letter. Okay, I know this was a very quick video and I know these are the main types of specialities that you may usually ask to write. We are planning to upload a series detailing about all these types of nurses and their job roles. So if that is something that you would think, please comment so we can look into that. But today I've only glanced at the different types of, only glanced into the different types of specialty nurses that you may be asked to write a letter. So I think by this video and with the previous video, we have covered any nurse that you may be asked to write in a letter. So if you get your reader as a community nurse, you don't have to worry. Go back and watch the previous video. If you get a school nurse, don't worry. If you get a psychiatric nurse, don't worry. Or any specialty nurse, don't worry. You have a vague idea about what are you going to say. And that is more than enough for your content selection. And now go to the discharge plan always or the transfer plan always and choose your content accordingly. Okay, so I hope this video was useful for all of you. I'm really thankful for all of you who support us. Please keep on supporting us. That is, very encouraging, basically. Okay, again, if you wish to have online course details, please log on to our website, english369.uk. I've also included my WhatsApp number with the description, so you can have a look in the description and WhatsApp me for any online course details. If you have any specific queries, you can also email me at oit369@gmail.com. Thank you so much and keep on watching OET369. Bye-bye.